Good evening, ladies and gentlemen, and welcome to the American Academy of Nursing's 2018 Induction Ceremony and Celebration. I'm Karen Cox, and it's my honor to serve as the Academy's president. Today, I'm joined by Eileen Sullivan-Marks, the Academy's president-elect, and Eileen and I are pleased to host this event. Nursing is a profession that is increasingly recognized as important in healthcare worldwide, both as practicing professionals and leaders. Our induction ceremony serves as a celebration of our profession. We honor a group of professionals whose achievements are distinguished, influential, and transform health policy and practice. So let's begin our evening celebration by recognizing this year's living legends. Within the Academy, we recognize a select group of fellows whose lifetime accomplishments are so distinguished as to render them legends in their own time, living legends. On Thursday, I had the honor of announcing the 2018 Living Legends. If you please, I ask that each of the living legends stand when I call your name. Jacqueline Campbell, Marilyn Chow, Ada Jaycox, Joanne Dish, Beatrice Kalish, Sally Lusk, and Ruth McCorkle. At this time, I would like to recognize the extraordinary leadership the Academy has been fortunate to have over the years. That leadership has come not only from the people serving on the board of directors, but from all of their fellows who have unselfishly given their time and talents to advocate for promoting the health of individuals, families, and communities. First, our charter members. The first cohort of fellows have guided the Academy since its inception in 1973, 45 years ago. We also have a number of our past presidents in the room, people who assumed the ultimate responsibility for driving the Academy and nursing to new heights during their tenure. I want to ask all of our charter members and past presidents to stand and receive your expression of thanks for their service and commitment. Thank you for your leadership. The first award of tonight's celebration is the Healthcare Leader Award, which recognizes an influential national leader dedicated to improving the health of the nation through contributions to organizational excellence. The Healthcare Leader Award has only been given by the Academy twice, in 2008 to Governor Janet Napolitano and in 2016 to Dr. Mary Wakefield. It is my honor to introduce the third recipient of the Healthcare Leader Award, Dr. Pamela Cipriano. Dr. Pamela Cipriano is the 35th president of the American Nurses Association. Shortly after assuming the presidency in 2014, she became the face of the public face of nursing in response to the arrival of Ebola on U.S. shores. In dozens of interviews for print, TV, and online media outlets, she was a credible voice who reduced misinformation about the outbreak and advocated for evidence-based practice, earning AAN, the American College of Medical Quality's 2015 Institutional Leadership Award. Dr. Cipriano was also elected to the Board of Directors of the International Council of Nurses in 2017 and serves as the first vice president. She is known nationally and internationally as a strong advocate for healthcare quality and advancing nursing's influence on healthcare policy. Throughout her career, she has consistently been an advocate for nursing and for improving the health and healthcare in our nation and around the world. I can think of no one more deserving of this award, and it is my sincere pleasure to present to you Dr. Pamela Cipriano, the Academy's 2018 Healthcare Leader Award. Thank you. Before we recognize our new 2018 class of Academy Fellows, please join me in thanking the members of the Academy's Fellow Selection Committee, led this year by Judy Beal, Ann Gross, and David Keepnews. The selection committee reviewed 283 applications and selected 190 new fellows. Will the members of Fellow Selection Committee please stand? Thank you for your exceptional work in selecting what is an outstanding 2018 class of new Academy Fellows. Now, in order to move through our induction in a way that's efficient, we ask that you limit your applause, not eliminate it, because that would never happen anyway. Because we know what an important event this is in the new fellows' lives, but we ask you to limit it and refrain from greeting the new fellows during this ceremony, and there will be plenty of time for that afterward, I promise. We'll be introducing these outstanding new fellows in groups according to their country or state, and weaving in our honorary fellows as well. Please follow along in your programs where outstanding work of these new fellows is provided in depth and in more detail. Eileen and I have practiced everybody's names, but I don't think we will, but if we do get it wrong, please let us know immediately and we will reintroduce you, because we know that's important. All right, here we go. Our first fellows to be inducted tonight join us from the state of Alabama. Gwendolyn Childs. Dr. Childs' program of research has reduced the risk of sexually transmitted infections in adolescent African American girls, focusing on sexual decisions and risk-taking among African American girls aged 12 to 14 years of age living in the Deep South region of the U.S. Her work informs research aimed at adolescent relationship abuse and dating violence and sets agendas for AIDS policy. She is also on the board of the Association of Nurses in AIDS Care. Welcome to the Academy. Allison Shorten. Dr. Shorten's 25 years of pioneering work established evidence supporting pregnancy decision aids to empower women making childbirth choices after a cesarean section. Her Birth Choices Decision Aid, now translated in 4 languages, is widely used in clinical practice and influences shared decision-making research globally. Her efforts inform policy by linking the best models of pregnancy care to birth outcomes at lower costs. Welcome to the Academy. From the state of Arizona, Karen Johnson. Dr. Johnson's leadership in critical care nursing research, education, and practice worldwide has driven innovation to influence hundreds of nursing research projects that transform critical care across decades as a national leader and educator, having served on the board of the American Association of Critical Care Nurses and several schools of nursing. She now leads research in a healthcare system comprised of 15,000 nurses in 28 hospitals in 5 states. Welcome to the Academy. Leslie Kelly. Dr. Kelly's research on nurse burnout, the healthcare work environment, and leadership behaviors enhance the way nurses are have meaningfully been recognized, change the processes and response to secondary trauma in hospitals. It also increased knowledge and awareness around compassion fatigue, burnout, and recognition in the interprofessional setting, leading to improved outcomes for patients. Welcome to the Academy. Judith O'Haver. A retired lieutenant colonel in the Air Force Reserves, Dr. O'Haver is a leading researcher, practicing clinician, and educator. Her health promotion research focuses on children and adolescents with dermatologic conditions in underserved pediatric populations. For 15 years, she has practiced in a free clinic in Nogales, Arizona, for children with Mexico with dermatologic disease and embarked on numerous international missions. Thank you for your service and welcome to the Academy. Rudy Valenzuela. Dr. Valenzuela is a Roman Catholic priest, a humanitarian, and a family nurse practitioner. He serves as the president and CEO of the Friars of the Sick Poor Health Ministries. His dedication, leadership, and expertise on caring for migrant workers and homeless persons has improved the health of underserved communities across political, health, and social groups on both sides of the U.S.-Mexico border. Welcome to the Academy. Cynthia Keener. As a U.S. Navy leader, Captain Cynthia Keener has decades of military health expertise with the coordination of health and nursing resources across a complex system of casualty and peacetime care. At the height of combat operations in Fallujah, Iraq, she coordinated care to over 1,000 critically injured multinational service members and local nationals. This work highlighted the capabilities and roles of advanced practice nurses in naval medicine. Thank you for your service, and welcome to the Academy. Odette Best. Let me start again. From the country of Australia, Odette Best. Dr. Best is an Aboriginal Australian registered nurse whose foundational work chronicled the history of Aboriginal women who served as nurses and midwives. She won the Australian Education Publishing Award for the best wholly Australian teaching and learning resources for a textbook she authored with Indigenous Australian nurses and midwives, the only one of its kind. Welcome to the Academy. Tracy Bucknell. Dr. Bucknell's research has focused on identifying and closing gaps in nursing practice with innovative interventional research. By increasing the use of research in nursing practice, her work has improved patient safety, alleviated patient symptoms, and enhanced the patient experience. Welcome to the Academy.
From the state of California, Connie Barden. Connie Barden was the first clinical nurse specialist in tele-ICU, allowing her to significantly shape this nascent subspecialty at the national level. She brought together tele-ICU leaders from across the country with the American Association of Critical Care Nurses to create the first guidelines for tele-ICU, nursing practice, and subspecialty certification. She is currently serving as the first Chief Clinical Officer for AACN. Janice Bell. Dr. Bell is a nurse scientist and health services researcher whose research focuses on chronic and serious illness care models and related policy efforts. Her work tests innovative intervention approaches, including nurse-led care coordination and faith-based lay care navigation based on work with 14 African American church communities. Sasha Alicia is the co-author of 3 nurse anesthesia textbooks, including the definitive core text, Nurse Anesthesia, and co-creator of a common clinical assessment tool in nurse anesthesia. His trigger videos, which model the use of crises management checklists during actual clinical scenarios, have been viewed over 150,000 times on YouTube. Welcome to the Academy. Eileen Catherine Fry Bowers. Dr. Fry Bowers has improved the care of vulnerable children, families, and communities through scholarship in health literacy, health policy, and organizational leadership in nursing. Her innovative Health in All policies framework came to life when she placed multidisciplinary students in the public sector into a regional health policy fellowship program. She currently sits on the Health Policy Advisory Council of AACN and the board of the Institute of Pediatric Nursing and is a licensed attorney. Welcome to the Academy. Carol Goodyear. Dr. Goodyear's signature message, "To lead when it's most uncomfortable," motivates nurses to take on complex delivery challenges. She designs, initiates, and sustains local, regional, and national leadership programs, empowering nurses to take on complex care delivery challenges while eliminating barriers to achieving optimal patient outcomes. She is past president of the American Association of Critical Care Nurses. Allison Holman. Dr. Holman is an internationally recognized researcher who examines acute stress as an early predictor of trauma-related health problems, especially cardiovascular disease. Her research has shaped public health interventions designed to limit the media's impact on health following large-scale community-based trauma. Welcome to the Academy. Ulrike Mensch. Dr. Mensch's research advances the nursing workforce, generating knowledge that informs policies and payment, increases access, and promotes equity. She documented an earnings gap between women and men among U.S. nurses and abroad, prompting hospital administrators to reevaluate their pay structures. The results of her research were published in 13 countries. Welcome to the Academy. David Pickham. Dr. Pickham is a transformative scientist, leader, and entrepreneur. His innovative work with novel technologies advances electrocardiographic diagnostic and screening criteria, led to new insights into pressure injury prevention practices, and improved human technology interfaces for civilian and military medical documentation. Welcome to the Academy. Caroline Stevens. Building on nearly 20 years of pioneering practice as a geriatric nurse practitioner and geropsychiatric APN, Dr. Stevens has produced clinically driven, high-impact, interdisciplinary research that positively affects care quality for older adults and those living in nursing homes with complex physical and mental health needs. She is the first nurse PhD to receive the prestigious K76 Paul P. Beeson Leadership Career Development Award in Aging Research, an award typically reserved for physicians. Welcome to the Academy. Elizabeth Johnston Taylor. Dr. Johnston Taylor's research investigates spiritual and religious responses to illness, as well as patient and caregiver preferences related to nurse-provided spiritual care. New measures to provide ethical, holistic care based on her research are now in use around the world. Welcome to the Academy. Matthew Tierney. Matthew Tierney is a practicing clinician and teacher whose work focuses on improving opioid addiction treatment delivery locally, regionally, and nationally. He creates innovative clinical programs and empowers healthcare providers to fill the gap between treatment need and delivery by destigmatizing opioid use. He has disseminated addiction treatment education at universities, community colleges, not-for-profit and public health venues, at over 60 invited presentations at conferences and educational forums, and in book chapters and peer-reviewed journal articles. Welcome to the Academy. Gail Washington. Dr. Washington's research, which examines health disparities among older adult ethnic minorities, created an instrument to measure the association of perceptive reflection and sense of personal well-being. Her modified Reminiscence function scale has been included in the world's most comprehensive international database for the healthcare sciences. Welcome to the Academy. From the country of Canada, Chantal Cara. Dr. Cara is a renowned bilingual expert in the field of human caring. Awarded the title of Distinguished Caring Science Scholar, French-speaking countries recognize her as their leading human care science expert in practice, education, and research. Her French humanistic model of nursing care and the relational caring inquiry research methodology are both being used in several countries. She holds an editorial board position on the International Journal for Human Caring and is a reviewer for the Advances in Nursing Science. Welcome to the Academy. Doris Greenspoon. Dr. Greenspoon propelled a major nursing professional association in Ontario onto the global stage by introducing the Best Practices Guidelines program for clinical excellence. These evidence-based clinical practices, which are available free of charge, have been translated into 8 languages. More than 50,000 point-of-care nurses now guide BPG uptake on 5 continents. She is the Chief Executive Officer of the Registered Nurses Association of Ontario. Welcome to the Academy. Doris Howell. Dr. Howell's cancer research addresses self-management and health service interventions to reduce cancer patients' distress and improve their quality of life. She led the development of a bedside-biased approach for testing patient-reported outcomes as part of a symptom self-management. She has led systematic reviews and developed pan-Canadian guidelines for management of cancer, physical symptoms, and emotional distress as part of cancer control efforts in Canada. These guidelines have been adapted for use across Canada, North America, and Australia. Welcome to the Academy. Elizabeth Peter. Dr. Peter's scholarship and leadership in healthcare ethics have contributed to theory and methods, home and community care, and research ethics. Her work has influenced the development of guidelines in policy and ethics and novel approaches to the social policy components of healthcare ethics. Welcome to the Academy. Robin Stremler. Dr. Stremler documented the poor psychological outcomes of sleep deprivation in hospitalized children. children receiving medical care at home, and their parents. She has also tested interventions to improve postpartum sleep. She is exploring the use and value of wearable sensors and mobile health technologies through a series of federally funded studies of sleep assessment and intervention. Welcome to the Academy. From the state of Connecticut, Xiaomei Kang. Dr. Kang is one of the first nurse scientists in the U.S. to investigate the cumulative effect of pain stress in high-risk infants' early life. Her research addresses biobehavioral and multi-omic mechanisms of early life experience and neurodevelopment and implementation of pain and symptom management in vulnerable populations. Welcome to the Academy. Allison Moriarty Daly. Dr. Moriarty Daly is a pediatric nurse practitioner, educator, and nurse scientist. Her work focuses on improving healthcare services through strengthening and enhancing clinical care models in school-based health centers and improving access to quality preventive care for adolescents. Welcome to the Academy. Sheila Maloney. Dr. Maloney's research addresses the importance of at-homeness and individually tailored care that incorporates the voices of older adults and families in creating healing interventions and environments. Her work related to person-centered approaches for older adults, particularly her dementia care practice guidelines, guide practice in the United States and internationally. Welcome to the Academy. Janine Kelly Tomlinson. An executive nurse leader in occupational health, Dr. Tomlinson led national and international corporations to embrace health, well-being, and optimal living for employees and their families. Before population health was commonplace, Jeannie innovated strategies that holistically and cost-effectively elevated quality of life. Welcome to the Academy. Sanwal Shou. Dr. Shou's scholarship on multidisciplinary research has contributed to cancer symptom science and identification of molecular mechanisms that could reduce cancer and treatment-related burdens to improve patients' quality of life and long-term care survival. Welcome to the Academy.
Each year, the Academy's board receives nominations for honorary fellowship. These fellows are professionals who've made outstanding contributions to nursing and healthcare, but would not qualify for membership as fellows because they're not nurses. This year, the board has selected 4 individuals to honor for this honor. Our first honoree is Martin A. Dornbaum. Martin Dornbaum is the founding director of the Health Professions Education Center at the Hunter Bellevue School of Nursing. For 30 years, he has utilized evidence-based pedagogy to increase student engagement and enhance learning strategies through the innovative use of technology. Curated by Mr. Dornbaum, the Health Professions Education Center's large collection of health-related media is visited by multimedia producers and nurse researchers worldwide. He leverages these contacts to improve the public's awareness of nursing issues. Mr. Dornbaum has produced or consulted on dozens of independent health films, and his critical reviews of nursing software are highly respected. His decades of service to the nursing community have had a profound influence on the clinical skills and health education of thousands of practicing nurses. We welcome Martin Dornbaum into the Academy as an honorary fellow. From the District of Columbia, Mary Daymont. Dr. Daymont, a revenue cycle and care management expert, uses her nursing acumen to develop innovative clinical financial models of care. She helps hospitals and health systems across the nation improve or expand care management services to meet the quadruple aim and value-based care objectives. Welcome to the Academy. Michelle Dunwoody. Michelle Dunwoody is Chief Nurse Executive for the Federal Bureau of Prisons and a Rear Admiral Assistant Surgeon General for the U.S. Public Health Service. Rear Admiral Dunwoody provides national-level policy and health leadership to one of the country's most vulnerable populations, the incarcerated, as well as the nurses who care for them. She has been on active duty for a total of 28 years with combined United States Army and United States Public Health Service commissions. Thank you for your service and welcome to the Academy. Robin Fleming. Dr. Fleming applies her interdisciplinary expertise to reduce health and educational inequalities in the U.S. She created a public health career pathway for immigrant students and a peer health education program for school-based health services. Her work has informed school-based health care in Washington State and nationally. Welcome to the Academy. Joyce Ann Hahn. Dr. Hahn's significant contributions evolved from her professional commitment towards ensuring a representative voice for nursing in advancing regulatory and health policy. She has consistently championed practice changes to remove the practice barriers affecting the nursing workforce and the APRN scope of practice. She is currently serving her third gubernatorial appointment to the Virginia Board of Nursing. Welcome to the Academy. Irene Trywell Harris. Dr. Trywell Harris translates strategy into policy through her work with the U.S. Air Force and the Veterans Administration. She was the first Air National Guard nurse in history to command a medical facility and the first African-American female nurse in 357 years of A&G history to be promoted to general officer. By serving on prestigious committees, she has successfully influenced military and federal committees to expand health care access and equity for women veterans and military service members. Thank you for your service and welcome to the Academy. From the state of Florida, Mindy Anderson. Dr. Anderson has influenced nursing education through her work in simulation-based research. Her efforts not only advanced simulation as a teaching modality, they provided the educational cornerstone for the next generation of interprofessional simulationists. She recently completed a Fulbright specialist placement and serves on the International Nursing Association for Clinical Simulation and Learning Conference Committee. Welcome to the Academy. Teresa Becky. Dr. Becky's internationally recognized expertise centers on developing effective secondary prevention of cardiovascular interventions for women. She was the first to design and test in an NIH-funded study a motivationally enhanced, gender-specific cardiac rehabilitation for women. She is now incorporating this work into a home-based cardiac rehabilitation intervention using mobile health technologies and wearable sensors. Welcome to the Academy. Miriam Izemwa. Dr. Izemwa's research addresses health disparities in pain management in patients with sickle cell disease or cancer. Her research on disparities in pain management led to the creation of the first ever Healthcare Justice Questionnaire. This questionnaire casts ineffective pain management as a healthcare injustice. Welcome to the Academy. Teresa Gore. Dr. Gore combines her expert clinical skills with simulation to advance nursing practice. She is one of only 30 to hold the advanced certification in healthcare simulation worldwide. Dr. Gore led the team that developed the International Nursing Association for Clinical Simulation and Learning and the CAE Simulation Standards Fellowship, which educated participants from the US, Europe, and the UAE to operationalize the standards in their home locales. Welcome to the Academy. Kathleen Hunter. Dr. Hunter is an informatics nurse specialist, board certified in nursing informatics, a nurse educator, as well as an academician. She designed curriculum for the nursing informatics specialization. She was instrumental in creating the Tiger-based assessment of nursing informatics competencies. Welcome to the Academy. Scarlett Mueller. Scarlett Mueller was the first nurse to chair the National American Cancer Society Board. Her long-standing service and leadership in professional and nonprofit organizations has had a significant effect on cancer care and nursing locally, statewide, and nationally. Welcome to the Academy. Maria Olenek. Dr. Olenek directs a Veterans Administration nurse academic partnership that uses veteran-centric curricula to prepare nurses and healthcare teams to participate in evidence-based healthcare practice. This preparation has improved veterans' quality outcomes as well as influenced healthcare policy for this important population. Welcome to the Academy. Maria Angel Las Ordonez. Dr. Ordonez practice focuses on meeting the complex needs of patients affected by the psychosocial burden of dementia with culturally and linguistically appropriate nursing, science-based interventions dedicated to unserved and underserved communities. Her nurse-led model of care has been successfully replicated nationally and internationally. Welcome to the Academy. Pamela Piper. Dr. Piper is a pioneer in pediatric trauma and surgical nursing and a founder and member of the American Pediatric Surgical Nurses Association. The pediatric surgical nursing textbook that she edited is used internationally and has received an American Journal of Nursing Book of the Year award. Welcome to the Academy. Alicia Gill Rossiter. Dr. Rossiter's seminal doctoral scholarship used an emerging approach, acceleration response therapy, to help women veterans manage PTSD related to military sexual trauma. Her results added to the evidence base, which prompted the Department of Defense to incorporate this approach into its Substance Abuse Mental Health Services Administration Registry. Dr. Rossiter served over 24 years in the United States Army Nurse Corps on active duty and the United States Air Force Reserves. Thank you for your service, and welcome to the Academy. James White IV. Dr. White, who served more than 2 decades in the Marines and Nurse Corps, entered academia to develop measurement of expert performance of nurses, the classification of novice clinical behaviors and cognitions, and the novel approaches to care for people living with HIV/AIDS. Thank you for your service, and welcome to the Academy.
From the state of Georgia, Diane Dowling Evans. Dr. Diane Dowling Evans pioneered the role of the nurse practitioner in emergency nurse practice and has spent the past 3 decades leading initiatives to advance this practice. Her research, practice, and teaching center on collaborative efforts that have improved emergency care access, delivery, and quality nationally and internationally. Welcome to the Academy. Ann Fitzpatrick. Dr. Fitzpatrick's research has proven that pediatric asthma is more heterogeneous than previously thought, which had led to varied responses to one-size-fits-all treatment approaches. Her work explains why the unique molecular features of children with asthma warrant alternative therapeutic strategies and personalized medicine. Welcome to the Academy. Twila Locklear-Haynes. Ms. Locklear-Haynes designed a global health course which incorporates a clinical practicum in Haiti. The 900 nursing students who participated provided care for 7,000 Haitians each year. She also founded a care facility for 200 medically fragile children in Haiti, the country's only orphanage created by a nurse. Welcome to the Academy. Lisa Muirhead. Dr. Muirhead has directed national competitive VA awards for educating nurses and APRNs that strengthen the VA's nursing workforce and expanded veterans' access to care. Her work to reduce health disparities among vulnerable population helped shape nationally published public health recommendations. Welcome to the Academy. Mary Dixon Still. Mary Dixon Still was instrumental in developing ways to provide continuous renal or kidney replacement therapy for patients in acute hepatic failure outside the walls of the ICU, as well as in the operating suite during liver transplantation. She trained nurses as experts in molecular absorption recirculating system, MARS, and wrote the MARS procedures featured in the American Academy of Critical Care Nurses' 2017 manual. Welcome to the Academy. From the state of Hawaii, Catherine Finn Davis. Dr. Davis has answered the international call to transform healthcare through the synthesis of evidence implemented and disseminated across multiple practice settings. Her impact can be measured by how quickly evidence-based guidelines are being incorporated into nursing practice. Welcome to the Academy. Mary Frances Oneha. Dr. Oneha has spearheaded the effort to integrate Native Hawaiian cultural values and practices into healthcare practice and research. She has been honored by the White House as an AAPI Woman Champion of Change. She currently serves as secretary of a Native Hawaiian Health Consortium, leveraging resources to improve the well-being and life expectancy of Native Hawaiians. Welcome to the Academy. From Hong Kong, Carmen Wing Han Chan. Dr. Chan's pioneering work in the identification and non-pharmacological management of symptom cluster in patients with lung cancer has been called novel and significant. Her ongoing promotion of advanced care planning encouraged patients in Hong Kong to accept and adopt advanced directives. She is currently the advisor of the Hong Kong Association of Palliative Nursing. Welcome to the Academy. Wai Tong Chien. Dr. Chien is active in academia and mental health nursing research. His mental health research and services have improved the psychosocial health of people with severe mental illness and their families in his native Hong Kong and Chinese community at large. Welcome to the Academy. From the state of Illinois, Kathleen Bobe. Dr. Bobe's research demonstrates how nurses can use standardized assessments of discharge readiness to reduce readmission and emergency department visits. She has been funded by the Robert Wood Johnson Foundation and the American Nurses Credentialing Center. Her teams recently completed a project that involves 33 hospitals in the US and other countries. Welcome to the Academy. Susan Corbridge. Dr. Corbridge has enhanced nurse practitioner practice and policy at the national level by leading, developing, and disseminating innovative educational and practice models to meet the challenges required to care for vulnerable populations, such as underserved patients on Chicago's West Side and the prison population in Illinois. She has developed cutting-edge resources, initiatives, and curricula for advanced practice nurses and nursing organizations with a focus on educational and policy initiatives for nurse practitioners. Welcome to the Academy. Valerie Gross. Valerie Gross combines her research and clinical experience in geriatrics to enhance the care provided to older adults and persons with Alzheimer's disease in the US and globally. She established an education program to prepare healthcare professionals to provide patient-centered geriatric care and developed a free downloadable mobile app for the families. Welcome to the Academy. Mary Catherine Capella. Dr. Capella is principal investigator on a federally funded clinical trial determining the efficacy and mechanisms underlying a unique form of biobehavioral therapy for patients with insomnia and chronic obstructive pulmonary disease. Her work amplified the realization that fatigue reduces physical function and insomnia contributes significantly with COPD. Welcome to the Academy. Carrie Klima. Dr. Klima's research has focused on centering pregnancy and its impact on perinatal outcomes. She developed the Pregnancy-Related Empowerment Scale to measure the effect of empowerment on prenatal care. Her current research explores group antenatal care and its effects on perinatal outcomes in sub-Saharan Africa. She is currently the chair of the Division of Research of the American College of Nurse Midwives. Welcome to the Academy. Gwen McNatt. Dr. McNatt has spent more than 30 years in nursing and administration for patients with organ transplantation. Her clinical practice primarily focuses on the long-term care of living kidney donors. Dr. McNatt's leadership and expertise has been instrumental in shaping transplantation policy at the state and national levels. Welcome to the Academy. Todd Rupar. Dr. Rupar is an internationally recognized expert on medication adherence. His combination of policy initiatives and targeted research projects has strengthened the evidence base for adherence interventions and influenced research and health policy in the U.S. and abroad. Welcome to the Academy. Karen Sabin. Dr. Sabin leads interventions to reduce stress-related inflammatory response among vulnerable populations of women at risk for cardiovascular disease and stroke. Internationally recognized for her expertise in enhanced resilience, she is committed to improving the health of disadvantaged women. Welcome to the Academy. Judith Schleger. Dr. Schleger is a certified nurse midwife and licensed acupuncturist. She is a pain researcher and focuses on developing new treatments for chronic pain by integrating conventional and traditional Chinese medicine. Specifically, she focuses on developing new treatments for vulvodynia. Her research promotes a paradigm shift away from addictive opioids. Welcome to the Academy. Matthew Sorensen. Dr. Sorensen's research is focused on immunologic correlates of fatigue in individuals with neurologic disease and chronic fatigue syndrome. His work has demonstrated a potential immunologic basis for disease pathogenesis in the chronic fatigue of patients with multiple sclerosis and chronic fatigue syndrome. Welcome to the Academy. Linnea Wendell. Linnea Wendell has created healthcare systems and models that improve access to high quality and affordable services, resulting in comprehensive primary care for 500,000 underinsured and uninsured people in suburban Chicago. She developed and implemented an innovative primary care model that leverages advanced practice nurses. Welcome to the Academy. From the state of Indiana, Lisa Carter Harris. Dr. Carter Harris pioneered patient-centered research to support shared decision-making in complex cancer screening decisions, specifically lung cancer. Through rigorous funded research, she has transformed nursing practice by bringing the critical patient perspective to improve patient-clinician discussions about important screening decisions. Welcome to the Academy. Kimberly Harper. Kimberly Harper's leadership in Indiana workforce development, along with her leadership of the Nurses on Boards Coalition, has prepared thousands of nurses nationally and internationally to serve on boards and commissions. As a result, 5,000 NBOC-prepared U.S. nurses now serve on public, private, and organizational boards. Welcome to the Academy. Wendy Miller. Dr. Miller heads a research program focused on developing sustainable patient-centered interventions to improve the quality of life for adults living with epilepsy. She pioneered the use of social media and big data methods to reveal patients' most salient epilepsy-related concerns. Welcome to the Academy. Joyce Pittman. Dr. Pittman is a practicing clinician, researcher, and educator focusing on wound, ostomy, and continence conditions. Her research addressing pressure injuries and prevention strategies has provided an objective method for determining appropriate pressure injury prevention. Her pressure ulcer injury prevention inventory validates that pressure injuries are unavoidable, even in instances of optimal care. Welcome to the Academy. Cynthia Vlasic. Dr. Vlasic's contributions have influenced policy and leadership to elevate nursing nationally and globally. She launched the Institute for Global Healthcare Leadership Institute, which convenes an annual symposium. Through her work with the American Red Cross, Sigma Theta Tau International, and the Institute, she has positioned nurses to take the lead in advancing global health. Welcome to the Academy.
From the state of Iowa, Sandra Dack Hirsch. Dr. Dack Hirsch built an academic career that bridges genetic science with real-world application. Her work has led to policy and educational changes in the U.S. and globally to ensure that public's access to quality genomic health services. Her models explaining how nurses can incorporate genetics and genomics into their practice and research have been recognized globally. Welcome to the Academy. M. Lindell Joseph. Dr. Joseph co-developed the General Effective Multi-Level Theory for Shared Governance, the first theory to advocate for shared governance in nursing and nursing's involvement in decision-making. Her work includes 3 frameworks designed to foster innovation in nursing. Welcome to the Academy. Susan Van Cleve. Dr. Susan Van Cleve is an experienced pediatric nurse practitioner, educator, and clinician who has advocated for the use of pediatric nurse practitioners as a way to address the crisis of access to mental health care in the U.S. She is a well-known speaker and advocate for mental health care for children and adolescents. Welcome to the Academy. From the country of Ireland, Elizabeth Adams. Elizabeth Adams has extensive policy and clinical nursing practice experience nationally and internationally. She has strategically driven and influenced the global health agenda in relation to leadership, education, research, professional practice, and policy. She is president of the European Federation of Nurses Association, which represents 3 million nurses. Welcome to the Academy. From the country of Italy, Alessandro Stivino. Dr. Stivino is currently Associate Director in Nursing and Health Policy for the International Council of Nurses and an academician. He also serves as Research Coordinator for the Center of Excellence in Nursing Scholarship in Rome, and which has funded more than 80 nursing research projects in the last 10 years. Welcome to the Academy. From the state of Kansas, Ginger Breedlove. Dr. Breedlove was president of the American College of Nurse Midwives from 2013 to 2016. She currently serves as founder and president of March for Moms, a nonprofit association uniting 40 organizations with similar aims to improve health of mothers and babies. Dr. Breedlove founded the first freestanding birth center in Kansas, the first nurse midwife practice in Greater Kansas City, and established the graduate education program for nurse midwives at the University of Kansas School of Nursing. Welcome to the Academy. From the state of Kentucky, AAN2018. Dr. Hootie is an academician and independently practicing women's health nurse practitioner. She is an international leader in perinatal bereavement through her research and the development of the Perinatal Grief Intensity Scale, an instrument for identifying loss and grief after loss. By enhancing the knowledge of current nurses and educating thousands of current and past students, Dr. Hootie has improved the quality of and accessibility to women's health care and improved the health outcomes of women, of thousands of women in America. Welcome to the Academy. Wait 1 second. Can you just back it up? I'm not going to read it off. I'm going to read it. So we got our name wrong, and it's AAN2018, Dr. Hutty. Congratulations. Tracy Williams. Dr. Williams is a strategic and operational health system leader who drives high-quality care for patients, caregivers, and communities. She is a leader in advancing academic practice partnerships at all levels in nursing, and particularly the Doctor of Nursing Practice, advanced nursing degrees. She recently served as the co-chair of the American Nurses Association Professional Issues Panel on Barriers to RN Scope of Practice. Welcome to the Academy. From the country of Lebanon, Hala Darwish. Hala Darwish's research focuses on the factors that lead to impairment or enhancement of cognitive function associated with multiple sclerosis and traumatic brain injury using neuroscience research methods. She is responsible for the overall management of the multiple sclerosis and neuroscience outpatient centers and continues to empower, train, and expand neuroscience nurse roles in Lebanon and throughout the region. Welcome to the Academy. From the state of Louisiana, Warren Hebert. A home health nurse since 1985 and CEO of the Home Care Association of Louisiana since 1998, Dr. Hebert co-founded the COSC exam, credentialing over 10,000 home care OASIS experts since 2004. For 10 years, he has hosted a radio program on Radio Maria USA in 9 states and on the web, and co-presents a monthly podcast. Nursing is a family passion, as his 2 daughters joined Warren in a family of 16 aunts, uncles, and cousins who are all RNs. Welcome to the Academy. From the state of Maryland, Ingrid Connery. Ingrid Connery led the effort to integrate physical and mental health to advance patient-centered care. Her research examines the association between clinical depression and outcomes. Her landmark study in cardiac surgery patients established a relationship between clinical depression and cardiac events. Welcome to the Academy. Jeffrey Doucette. Dr. Doucette leads the Magnet Recognition Program and Pathway to Excellence at the American Nurses Credentialing Center. Throughout his career, he has remained committed to increasing the personal effectiveness and health of nurses through well-being and resilience programs. An award-winning author, his ongoing research interests include Chief Nurse Officer retention, mindfulness in nursing leadership practice, and developing the next generation of nursing leaders. Welcome to the Academy. Deborah Holbrook. Deborah Holbrook founded a forensic nurse examiner program that became a model for the U.S. She is a subject expert for the Department of Justice and the U.S. military and has developed a model for mobility in forensic care. She educates professional nurses across the world to care for victims of violence and pioneered research using alternate light source, which set international precedents. Welcome to the Academy. Beverly Johnson. Beverly Johnson has led transformational change in patient and family-centered care through authentic partnerships with patients and families in the United States and Canada. She has brought together more than 300 hospitals and health systems, government agencies, military treatment facilities, and community organizations for collaboration that improved outcomes. Welcome to the Academy. Nada Lokahate. Dr. Luke Kahate's research produced innovative research discoveries on symptom science and management, such as the TIE pain scale, that directly translate into more effective clinical practice. She also pioneered the use of mobile technologies to improve patients' physical function, monitor symptoms remotely, and enhance patients' ability to self-manage at home. Welcome to the Academy. Shirley Nathan Pulliam. Senator Nathan Pulliam is currently serving her first term in the Maryland State Senate after being a member of the Maryland House of Delegates from 1994 to 2015. She is the first Caribbean-born person and first Afro-Caribbean American registered nurse elected to the Maryland General Assembly. She has sponsored hundreds of bills, including legislation creating the Office of Minority Health and Health Disparities within the Department of Health and Mental Hygiene for improved health care and health disparities reduction in Maryland. Welcome to the Academy. Cynthia Wren. Dr. Wren is a nurse scientist conducting translational research focused on understanding the physiological symptoms underlying the development and persistence of chronic pain using preclinical and clinical studies in several chronic pain populations. In 2008, she was named the Southern Nursing Research Society American Nurses Foundation Scholar. Welcome to the Academy. Janice Taylor. Dr. Taylor's research addresses pain disparities among aging Mexican American women and African Americans. She is the first nurse to participate in a national program to test a person-centered behavioral intervention to improve communication among providers treating chronic pain and depression in older African American women. Welcome to the Academy. Bridget Van Grafflin. Dr. Van Grafflin is practicing clinician, educator, and scholar. She combines her expertise in vulnerable populations and patient safety and quality to improve the healthcare outcomes of underserved children, their families, and society. She co-authored the first white paper on corporal punishment in pediatrics for the National Association of Pediatric Nurse Practitioners and implemented an influenza vaccine program that reached over 8,000 children in rural counties. Welcome to the Academy. Nicole Warren. Dr. Warren is a nurse educator and certified nurse midwife committed to reducing inequities in reproductive health outcomes in the U.S. and globally. Through teaching, research, and practice, she champions quality care for marginalized women. She led the revision of the position statement on female genital mutilation for the American College of Nurse Midwives. Welcome to the Academy. Candy Wilson. Dr. Wilson is a military officer, clinician, researcher, and academician. She is a colonel in the United States Air Force and has served in the active duty forces for 26 years. Her interest in symptom science research through an occupational health focus addressed military women's health needs that led to practice changes in addressing illness behaviors of deployed military women. Thank you for your service and welcome to the Academy. Shao Hassin Ye. Dr. Ye's research addresses a non-pharmacological intervention, auricular point acupressure, to manage pain in pediatric and adult oncology patients, older adults with chronic pain, and patients with dementia. She has led an NIH-funded study of auricular point acupressure to manage chronic low back pain in older adults. Welcome to the Academy.
Our second honorary fellow this year is Sharon K. Inouye. Dr. Inouye is professor of medicine at Harvard Medical School, Beth Israel Deaconess Medical Center, holder of the Milton and Shirley F. Levy Family Chair, and director of the Aging Brain Center at the Institute for Aging Research, Hebrew Senior Life. Dr. Inouye's work has focused on improving the quality, safety, and outcomes of hospitalization for older adults. Continuously funded by NIH since 1989, she developed a proven method for reducing delirium and functional decline in hospital older persons, the Hospital Elder Life Program, HELP. A nursing center volunteer-assisted program for prevention of delirium, HELP has been implemented in hundreds of hospitals around the world. She also created the well-known confusion assessment method, CAM, now the most widely used method to identify delirium worldwide. We welcome our friend Sharon Inouye into the Academy as an honorary fellow. Dr. Inouye is unfortunately recovering from surgery, doing well, but unable to travel to be with us this evening. One of her sponsors and a great colleague, Dr. Ann Kolanowski, is accepting on her behalf. Dr. Inouye, welcome to the Academy. From the state of Massachusetts, Anne Marie Barron. Dr. Barron's work focuses on serious illness and the power of nursing to address suffering and promote healing. She leads nursing initiatives on an interprofessional team that developed the first bone marrow transplant program in Bangladesh and has elevated nursing practice there. Welcome to the Academy. Dorothy Becca. Dorothy Becca has advanced the educational standards for pediatric cardiovascular care, improving the lives of children worldwide. She led the design and implementation of a web-based digital learning platform for pediatric clinicians that have been viewed in more than 153 countries and 2,800 hospitals. Welcome to the Academy. Catherine Gregory. Dr. Gregory's research addresses nutrition, gastrointestinal health, and development of the preterm infant. Her work relative to the intestinal microbiome has influenced how we care for preterm infants and is leading to a novel pediatric intervention tailored to gestational age and microbial health risks. Welcome to the Academy. Julie Lynch. Dr. Lynch is a leader in using data analytics and informatics tools to improve equity in precision medicine. As a nurse scientist at the Veterans Healthcare Administration, she works across clinical and research domains to translate and apply genomic advances to patient care. Dr. Lynch was the innovator and principal investigator of the VA GDX project, an informatics platform that captures and integrates genetic diagnostic testing into the VA electronic health record, which was developed into a mobile app. Welcome to the Academy. Mimi Secor. Dr. Secor has advanced the nurse practitioner profession by spearheading prescriptive authority legislation, creating a state NP organization, and establishing the first NP-owned practice in Massachusetts. Her current health initiative focused on helping RNs and NPs serve as healthy role models for the communities they serve. She also promotes NP practice as a national speaker, consultant, author, media expert, most recently as a health fitness advocate. Welcome to the Academy. From the state of Michigan, Rebecca Leto. Dr. Leto is a recognized leader in mental health adaptation and end-of-life research for patients with cancer. The impact of her work has been expanded through sustained community engagement with practicing nurses and interdisciplinary international researchers. These partnerships are improving evidence-based care throughout Michigan. Welcome to the Academy. Barbara Luke. Dr. Luke's research has focused on maternal nutrition, employment during pregnancy, and multiple births, including developing national weight gain guidelines for twins. She has led NIH-funded studies, which are the largest ever conducted, evaluating the health of families after infertility treatment. Welcome to the Academy. Melissa Milojevic. Dr. Milojevich's research seeks to advance patient safety by improving communication between nurses and physicians. Her work uses novel methods to assess clinicians' communication practices and promote the notion that effective communication involves a shared understanding between communicators. Welcome to the Academy. Patricia Thomas. Dr. Thomas created a strategic planning model that elevates nursing from an operational design to an organizational strategy. She is recognized for her seminal textbook contributions and scholarship related to the advancement of the clinical nurse leader role nationally and internationally. Welcome to the Academy. Hiba Bahaldin Weba Alama. Dr. Webe Alama is a transcultural healthcare scholar and academician. She co-developed the first award-winning prototype for a computer-based cultural simulation game, Cultural Copia. As a global change agent, she provides cultural competence training to nurses in 45 states and 25 countries. Welcome to the Academy. From the state of Minnesota, Timothy Bristol. Dr. Bristol is Chief Executive Officer of Nurse Tim, Incorporated, and an internationally recognized educator specializing in continuing education, faculty development, and student success. Known for creativity in learning and assessment, he built a philanthropic network of 45,000 educators, nurses, and students who provide service learning opportunities in America and Haiti. Welcome to the Academy. Mary Catherine Hook. In her research, Dr. Hook has examined the influence of physical activity on fatigue and other distressing symptoms in children undergoing cancer treatment. She has tested strategies for coaching families on physical activity as part of usual pediatric care and served as president of the Association of Pediatric Hematology Oncology Nurses, AAN, for which she received a Distinguished Service Award named in her honor. Welcome to the Academy. Kristen Sandow. Dr. Sandow's research focuses on the use of technology to enhance cardiovascular care. She led a national team that reviewed evidence for continuous ECG monitoring, which issued interprofessional national practice standards for cost-effective monitoring. For patients with a left ventricular assist device, her research team prioritizes patients' expectations for quality of life. Welcome to the Academy. Misty Lynn Wilkie. Dr. Wilkie, an enrolled member of the Turtle Mountain Band of Chippewa Indians in North Dakota, influences Indigenous healthcare equity and policy through her work with American Indian organ donation and transplantation. As president of the National Alaska Native American Indian Nurses Association, she influences Indigenous healthcare on a global scale. Welcome to the Academy.
From the state of Montana, Elizabeth Schenk. Dr. Schenk's primary research interest is the environmental impacts of healthcare, which she has been working to reduce for over 25 years. As part of her PhD work, she developed the Nurses' Environmental Awareness Tool, which measures nurses' awareness of these challenges, how related they are to health, and what they need to do about them. The tool has been used across the nation in 8 different countries and translated into 3 additional languages. Welcome to the Academy. From the state of Nebraska, Kathleen Hanna. Dr. Hanna's research with adolescents and emerging adults has contributed to an understanding of the critical transitions, identification of variables, and individuals with type 1 diabetes that need to be studied in further intervention research. She has contributed to the American Diabetes Association's care recommendations for emerging adults. Welcome to the Academy. Robin Lawley. Dr. Lawley's research uses e-health self-management intervention to reduce cancer-related distress and support psychological adjustment of women recently diagnosed with breast cancer. Her web-based intervention, Caring Guidance After Breast Cancer Diagnosis, has touched the lives of rural and urban women in 7 states. Welcome to the Academy. Anne Marie Laughlin. Dr. Laughlin developed initiatives that meet the needs of marginalized populations. These initiatives provide educational opportunities for nursing students to provide compassionate care to 9,000 vulnerable school-age individuals annually while gaining the competence to apply moral and ethical responses to complex healthcare issues. Welcome to the Academy. From the state of Nevada, Barbara St. Pierre Schneider. Dr. St. Pierre Schneider's impactful research addresses blood cell responses to skeletal muscle injury. Cited in molecular medicine and physiology journals, she has led Department of Defense funded studies, generating a scientific foundation for the nursing care needed for veterans and civilians who sustain traumatic muscle injury. Welcome to the Academy. From the state of New Jersey, Jerry Altmiller. Dr. Altmiller's research on constructive feedback, quality and safety education for nurses, QSIN, integration and clinical evaluation has led to support tools for nursing faculty and learning tools for students. She led the initiative to create QSIN regional centers, and her work has championed the integration of quality and safety competencies in nursing education and practice. Welcome to the Academy. Susan Kaplan. Dr. Kaplan's research, practice, and advocacy has focused on improving access to treatment of behavioral health care and reducing the stigma associated with our current epidemic of mental health disorders, including suicide and addictions. She has addressed mental health gaps, mental health literacy, and access to care using mobile health and innovative service delivery for Hispanics in the U.S. and internationally. Welcome to the Academy. Donna Cardillo. Donna Cardillo created a framework for nurses to create more autonomy, job satisfaction, and longevity. Her work helps to keep passionate, inspired nurses in nursing by seeing themselves as multidimensional, versatile professionals that transcend the work setting. Ms. Cardillo is the original Dear Donna columnist at nurse.com. Welcome to the Academy. Kathleen Neville. Dr. Neville's research probes the challenges of current nursing practice related to substance abuse, fatigue, interrupted sleep, and compassion fatigue. Her internationally used psychometric measure, the Nurses' Perception and Patient Rounding Scale, has transformed nurses' work environments to improve care quality and patient safety worldwide. Welcome to the Academy. From the state of New York, Frances Cartwright. Dr. Cartwright's outstanding contributions in nursing are exemplified by innovative service line and unit design, clinical program development, and peer leadership. Her work to advance evidence-based pain management practice resulted in policy and procedure change in 2 major academic medical centers. Welcome to the Academy. Jessica Kastner. Dr. Kastner's research addresses the nexus of physical environment determines health, data science, and emergency outcomes. Her work, which has deepened environmental health nursing research as a unique and rigorous specialty, has informed public policy and civic action to create healthier environments. Dr. Kastner has led multiple initiatives to overcome barriers for women in science, advance diversity and inclusion, and enhance cultural competence for the combat veteran family. Welcome to the Academy. Yu Ping Chan. Dr. Chan's research addresses integrated behavioral health and primary care services for those living with chronic pain, substance abuse, and prescription opioid abuse, especially older adults. She has demonstrated the effect of team-based behavioral interventions for addictions in primary care and created interprofessional education modules to train APRNs and behavioral health professionals. Welcome to the Academy. Emerson Ia. Dr. Ia's work has contributed to advancing the cardiovascular health and well-being of Filipino immigrants in the U.S. and globally. He developed the Kaya Co, the first culturally developed, I'm getting camera lights here. He developed Kaya Co, the first culturally tailored heart health education model for the Filipino immigrant population that empowers Filipino immigrants to adopt and maintain a heart-healthy lifestyle. Welcome to the Academy. Patricia Ann Eckhart. Dr. Eckhart has been a seminal leader as a practicing clinician, research nurse, and academician. Dr. Eckhart helped develop 5 nursing programs of research with several measurable outcomes, over 2,500 nurses trained, 100 plus publications and presentations of findings, and multiple grant submissions. Her own work has provided foundations for the self-management of health issues and healthcare workers' effect on patient population outcomes. Welcome to the Academy. Mattia Gilmartin. Dr. Gilmartin's career centers on developing nurses as strategic leaders at all organizational levels to advance healthcare system efficiency and clinical practice effectiveness. A distinguished leader in organizational change and leadership development, she exemplifies and demonstrates entrepreneurial approaches to complex problems. Welcome to the Academy. Sharon Hooner. As a nurse anthropologist and innovator in informatics and data science, Dr. Hooner developed clinical decision support tools to assess social determinants of health. She used those tools to analyze Medicaid claims data to demonstrate the value of nursing interventions. Welcome to the Academy. Mario Ortiz. Dr. Ortiz has a proven track record of developing community-based, nurse-led models of care with a focus on wellness and establishing critical partnerships with healthcare policymakers. He has garnered millions of dollars in endowments and grants to support community health initiatives. Welcome to the Academy. Virginia Paragallo Ditko. Dedicated to the care and education of people with diabetes, Virginia Paragallo Ditko's work spans executive leadership, service, scholarship, and policy. She has the distinction of being the only recipient of both elite national awards conferred to an educator in diabetes. Outstanding Educator in Diabetes by the American Diabetes Association, and Diabetes Educator of the Year by the American Association of Diabetes Educators. Welcome to the Academy. Roseanne Rosso. Roseanne Rosso is an urban nurse executive and editor-in-chief of Nursing Management, the Journal of Excellence in Nursing Leadership. She was one of the original contributors to the American Association Critical Care Nurses Standards for creating and sustaining health and work environments. She was the co-founder and past president of the Brooklyn Nursing Partnership, a collaboration of education and practice focused on increasing nursing capacity in Kings County, New York, and is past president of the New York Organization of Nurse Executives. Welcome to the Academy. Carrie Ann Scanlon. Carrie Ann Scanlon has combined her expertise in senior leadership and quality to develop transformational improvement science model that has affected, sustained, replicable improvements in care delivery, quality, engagement, and professional development across a 23 hospital system. It has resulted in sustained, replicable improvements in quality outcomes, employee engagement, and RN time at the bedside. Welcome to the Academy. Rebecca Schnall. Dr. Schnall is a pioneer in using mobile and web-based technology to advance HIV/AIDS care for racial, ethnic, and sexual minority groups and socioeconomically disadvantaged persons. She is among the earliest informatics researchers to operationalize information resources tailored to individuals' needs for health promotion and disease prevention. Her federally funded work has become a model for theoretically based mixed methods informatics research. Welcome to the Academy. Melissa Sutherland. Dr. Sutherland's research has advanced our understanding of interpersonal violence health outcomes among young women and the factors that influence healthcare providers' screening behaviors. She has led NIH-funded studies and recently completed a Fulbright Fellowship in Santiago, Chile, where she developed a family nurse practitioner program and launched a sustainable mentoring program to increase research capacity. Welcome to the Academy.
Our third honorary fellow this year is Patricia Pittman. Dr. Pittman is a professor of health policy and management at George Washington University's Milken Institute School of Public Health and School of Nursing. An expert in nursing policy and the health workforce, she serves as co-director of the GW Health Workforce Institute and director of the HRSA-funded Health Workforce Research Center. Her research on unethical contract practices used by the international nurse recruitment industry and her subsequent convening of stakeholders led to the Alliance for Ethical International Recruitment, an extraordinary agreement among labor unions, employers, recruiters, and professional groups that received major media coverage. Dr. Pittman's current research focuses on the changing roles of health workers, particularly nurses, as systems adapt to new payment and coverage policies. We welcome Patricia Pittman into the Academy as an honorary fellow. From the state of North Carolina, Tracy Goslin. Dr. Goslin is an experienced nurse administrator and clinician who has created and implemented care delivery models in major academic health centers. Her leading expertise in oncology and evidence-based practice has helped shape practice guidelines nationally and internationally. She is currently serving as a trustee on the Oncology Nursing Society Foundation Board. Welcome to the Academy. Eric Ashworth Hodges. Dr. Hodges' research aims to reduce early childhood obesity, a public health problem with lifelong implications. His influence through nursing, nutrition, and developmental expertise is evidence in national and international publications. His current work has the great potential for national implementation. Welcome to the Academy. Thank you. Valerie Howard. Dr. Howard's work as an academic nurse leader and champion of nurses on boards has provided seminal evidence-based simulation teaching methodologies to enhance the science of simulation. Her scholarship supports the ongoing development and global dissemination of simulation. She is the current chair of the AACN Organizational Leadership Network. Welcome to the Academy. So let's roll back.
That's just up there.
Right. Yeah. All right. So what's the correct? Oh, the title's wrong there. Oh yeah, she's not the dean. Marion Bloom's the dean. So she's the associate dean and university professor at Duke University. You didn't know you were elevated when you join the Academy. When you join the academies, wonderful things happen. Hoonee Kim. Dr. Kim's research focuses on facilitating the reuse of biomedical data via standardized representation to empower patients by providing a means to indicate their preference on sharing health data for research. The biomedical informatics community has recognized her work among the most notable contributions to the field. Welcome to the Academy. Valerie Sable. Dr. Valerie Sable is a practicing nurse, practitioner, and a teacher whose expertise addresses the global threat to obesity on mobility in our aging population. Through interprofessional collaboration, she influences safe care delivery and injury prevention across care settings. She is a fellow of the National League for Nursing's Academy of Nursing Education and the American Association of Nurse Practitioners. Welcome to the Academy. Susan Sinclair. Through her research, Dr. Sinclair advocates for improved participation in pregnancy registries to inform prescribing and disease management in women and men of childbearing age. Her work has influenced the design of pregnancy exposure registries in the US and globally. Dr. Sinclair is a consultant to the Food and Drug Administration's Drug Safety and Risk Management Advisory Committee and was an epidemic intelligence officer for the Centers for Disease Control and Prevention, earning the rank of Lieutenant Commander in the U.S. Public Health Service. Welcome to the Academy. Li-Shin Song. Dr. Song's research addresses symptom management and quality of life issues in elderly cancer patients and their caregivers. She is leading NIH-funded studies of technology-based translatable interventions that enhance post-treatment supportive care for prostate cancer patients and their caregivers. Welcome to the Academy. Cheryl Rogers. The Academy was deeply saddened to learn that one of our incoming fellows, Dr. Rogers, passed away on July 7th at the age of 51. Her research identified symptom severity and distress during children's cancer treatment and has facilitated targeted assessments in clinical practice. Her most recent work focused on education for parents of children newly diagnosed with cancer. Dr. Rogers was a member of the Duke University faculty since 2013. Dr. Marion Broom, Dean of the School of Nursing, is honored to accept her certificate. From the state of Ohio, Celeste Alface. Dr. Alface has made substantial contributions pioneering simulation training for air medical transport nurses globally. Her innovations have improved the training, practice standards, and utilization of advanced practice flight nurses as primary care providers within the air medical transport environment. As a National League for Nursing simulation leader, Dr. Alface has had the unique opportunity to promote simulation globally and champion a cohesive leadership group that fosters support, networking, and sharing of simulation resources. Welcome to the Academy. Carmen Gheorghescu. Dr. Gheorghescu's research addresses the effects of social factors and biomarkers on preterm birth. She is leading NIH-funded studies to examine the role of maternal and paternal social determinants of health on birth outcomes among African American families. Welcome to the Academy. Carolyn Thomas Jones. Dr. Jones's work in clinical research, workforce development, and core competency establishment has been globally influential. She leads NIH-funded initiatives, promotes the role of clinical research nursing, and simultaneously works as an academician and a mycology research consultant. Welcome to the Academy. Deborah Klein. Deborah Klein is a clinical nurse specialist in cardiovascular critical care. She contributes on the national and international levels through policy development, presentations, and publications that improve cardiovascular practice. Through the United States Department of State, she has directed an annual international course for nurses around the world to ensure practice is current and evidence-based. Welcome to the Academy. Deborah Lindell. Deborah Lindell has advanced nursing education through her proactive leadership. In addition, she has substantially influenced nursing, education, practice, and scholarship in Vietnam and China. She spearheaded the effort to develop, accredit, institutionalize, and expand the National League of Nursing's Certified Nurse Educator Program. Welcome to the Academy. Polly Mazanek. Dr. Mazanek is an oncology, palliative care, advanced practice clinician, researcher, and educator. She is leading the national ELNEC, End-of-Life Nursing Education Consortium, project to improve the care of those with serious illness by educating undergraduate and graduate nursing students to provide primary palliative care. Welcome to the Academy. Mary Beth Modick. Dr. Modick is a clinical nurse specialist whose research has influenced inpatient nursing practice rendered to persons with diabetes. She developed the Diabetes Management Knowledge Assessment Tool, which has reduced cost and lowered the near-miss incidences in hospitals across the country. Dr. Modick is a prolific writer and has authored or co-authored over 80 publications and co-edited a book for the lay public on optimizing their hospital experience. Welcome to the Academy. Sharon Etgar Black. Dr. Etgar Black is an attorney and nurse researcher who has led the development and evaluation of instruments designed to measure self-efficacy in the perioperative experience. Her work has provided empirical evidence that self-efficacy is important to incorporate into health instruction because it can predict engagement in behaviors. Welcome to the Academy. Heather Tubbs Cooley. Dr. Tubbs Cooley conducts health services research to evaluate outcomes of nursing care quality. Her nationally recognized work includes the discovery of effects of subjective nurse workload on missed nursing care in neonatal intensive care units, leading to new interventions that improve the quality and safety of nursing care in those units. Welcome to the Academy. Allison Webble. Dr. Webble's leading research focuses on improving self-management strategies for HIV-infected adults to live and age well. She has translated her research findings into widely read, highly engaging lay articles, which have been republished in newspapers around the world. Dr. Webble has described the benefits of employment on HIV self-management, which the Department of Labor translated into recommendations to increase work opportunities for this population. Welcome to the Academy. From the state of Oregon, Joanne Noon. Dr. Noon is nationally recognized for her health equity contributions that improve care for communities through empowerment of a nursing workforce. Her work addresses the social determinants of health to enroll, empower, and graduate nursing students from disadvantaged backgrounds to improve health equity in their communities. She is the Governor of Education for the Western Institute of Nursing. Welcome to the Academy.
From the state of Pennsylvania, Allison Colbert. Dr. Colbert is a clinician, scholar, and advocate committed to improving the health of women incarcerated in and those recently released from prison. Her state work has contributed to policy aimed at improving the lives of incarcerated pregnant women, increasing their access to care, educating providers, and addressing anti-shackling legislation. Welcome to the Academy. Congratulations. Diane Hupp. Dr. Hupp is a nurse executive with an exceptional career in pediatric nursing. Her contributions at a leading children's academic health center include developing and executing an East Coast pediatric transplant network to increase the number of children receiving transplants and development of national patient safety initiatives. She led the formation of the first pediatric condition help program, where a parent can call for assistance 24/7 if they have any concerns about their child's care in the hospital. Welcome to the Academy. Rebecca Ann Cronk. Dr. Cronk is a pioneer academician and pediatric nurse practitioner who has used her nursing and developmental psychology expertise to address care needs of children with genetically related disabilities. She fostered the establishment of a nurse-led, multidisciplinary Fragile X Center at a leading academic health center. Welcome to the Academy. Martha Kubik. Dr. Kubik's research advances understanding of the role of school nurses in decreasing childhood obesity. She was among the first to cite the school nurse as the linchpin of healthy weight management programs designed to curb childhood obesity. In 2018, she was appointed to the U.S. Preventative Services Task Force. Welcome to the Academy. Kathleen Orr Lindell. Dr. Lindell's program of research is targeted towards improving the quality of life for patients with advanced lung disease, specifically idiopathic pulmonary fibrosis, and their family caregivers. Her goal is to reduce suffering for patients with advanced lung disease through early referrals to palliative care. Welcome to the Academy. Jennifer Lingler. Dr. Lingler addresses the clinical and ethical issues associated with early detection of dementia. She was the first scholar to characterize the subjective experience of living with the uncertainty of mild cognitive impairment. Her current work is shaping policies and practices as we enter a new era of pre-mortem testing for Alzheimer's pathology. Welcome to the Academy. Bobby Pasmontier. Dr. Pasmontier's research addresses improving perinatal mental health outcomes among pregnant women and postpartum women and their infants. She led the only nurse-led interdisciplinary perinatal intensive outpatient program embedded in an academic setting that targets low-income minority women and their infants. Welcome to the Academy. William Edward Rosa. William Edward Rosa is a clinician, educator, and author in holistic nursing and global health, and a champion for compassionate healthcare system. Globally, he worked in Rwanda with the Human Resources for Health program and contributed to the curriculum for the country's first master's prepared nursing cohort. Welcome to the Academy. From the country of the People's Republic of China, Yan Hu. Dr. Hu is the Dean of the School of Nursing at Fudan University. She's a prolific author and the acting chair of CMB China Nursing Network. For decades, she has been a leading champion for the use of evidence that has advanced nursing practice in China and Asia. Her own research focuses on implementation science and knowledge translation. Welcome to the Academy. From the country of the Republic of Korea, Ta-ha Lee. Dr. Lee's research focuses on building nursing capacity and community-based health programs in developing countries. Her global expertise has influenced nursing policy and healthcare delivery systems in Fiji, Iraq, and Ethiopia. She worked to establish a national institute for advanced practice nurses in Bangladesh. Welcome to the Academy. From the state of Rhode Island, Deborah Erickson Owens. Dr. Erickson Owens' scholarly work on delayed cord clamping and cord milking at birth being associated with infants' improved brain development has influenced practice, research, policy, and education. Her innovative research has had worldwide impact, demonstrating that a simple birth intervention can improve the health of all infants. Welcome to the Academy. From the country of Slovenia, Mada Pajnkahar. Dr. Pajnkahar has shaped Slovenian nursing education, and her influence can be seen in ensuring master's level education for Slovenian nurses. In addition, she is the first to establish doctoral level education for Slovenian nurses at the University of Maribor. Welcome to the Academy. From the state of South Carolina, Stephanie Burgess. Dr. Burgess is a nurse practitioner and academician whose political activity changed health policies for nursing practice. Her advocacy has increased access to care, expanded scope of practice and reimbursement for APRNs, and improved patient outcomes. Her reform efforts in payer policy changes saved South Carolina over $100 million. Her successful and sustainable model of health policy reform has received national recognition. Welcome to the Academy. Rebecca Freeman. Dr. Freeman is an informational technologist and a nurse executive and entrepreneur in healthcare informatics. She provides nursing leadership advocating for comprehensive initiatives that support and implement innovations in the design and evaluation of health IT in clinical nursing practice. Welcome to the Academy.
From the state of South Dakota, Diane Lois Cudmore Birkland. Dr. Birkland is a nurse administrator who takes a bold direction in practice academic partnerships and support for APRN legislation that led to the successful passage of full scope authority for nurse practitioners and nurse midwives in South Dakota. Her health delivery innovations have had a positive effect on rural healthcare in the United States. Welcome to the Academy. From the country of Taiwan, Su-Wei Jane. Dr. Jane was the first researcher to launch a large-scale national translational study on the effects of massage therapy for palliative care among Taiwanese cancer patients and their family caregivers. This comfort program has been adapted nationally as a hospital-based comfort care program in Taiwan. Welcome to the Academy. Ya-Aing Lotus Shea. An expert on aging, Dr. Shu's research and leadership and policy has changed the way nurses in Taiwan take care of older people with dementia and hip fractures. Her research has advanced gerontological practice and policy in Taiwan, leading to her induction into Sigma Theta Tau's International Nurse Researcher Hall of Fame. Welcome to the Academy. From the state of Tennessee, Kathy Maxwell. Regarded as the voice of nursing within the trauma care systems of 2,000 U.S. hospitals, Dr. Maxwell's fragility outreach includes a novel bioenergetics component that advances the understanding of biological aging. She also advocates for using frailty screening as a trigger for early palliative care. Welcome to the Academy. Carol Myers. Dr. Myers is a leader in advocacy and media to promote population and rural health through APRN Full Practice Authority. Her non-traditional approaches and professional and policy initiatives have improved access, cost, and quality. She is the creator and host of the award-winning Health Connections, a radio show on the Knoxville NPR affiliate. Welcome to the Academy. Julia Philippi. Dr. Philippi is a researcher, educator, and practicing nurse midwife who investigates interprofessional prenatal care for at-risk women. She has advanced nurse midwifery nationally through research and representation of nursing and midwifery on interprofessional committees to improve competency standards in nurse midwifery practice. Welcome to the Academy. Mavis Shorn. Dr. Shorn is a practicing nurse midwife, academician, and researcher who has worked to reduce maternal morbidity associated with postpartum hemorrhage at local, regional, state, and national levels. She has played an instrumental role in supporting Full Practice Authority in conjunction with the Tennessee Nurses Association. Welcome to the Academy. From the state of Texas, Gary Bridges. Dr. Bridges is a practicing clinician, academician, executive, and national nursing leader. He combined his clinical expertise in opioid-sparing anesthesia and national leadership roles to influence APRN's scope of practice and policy on the opioid crisis. Dr. Bridges is the 2018-2019 president of the American Association of Nurse Anesthetists. Welcome to the Academy. Lisa Cleveland. Dr. Cleveland's research has demonstrated the importance of the maternal role in the management of newborn opioid withdrawal syndrome. Her work provides and evaluates opioid overdose identification and reversal education and training for first responders. Welcome to the Academy. Peggy Mancuso. Dr. Mancuso is a nurse midwife, educator, and researcher whose work revealed unanticipated effects of obstetrical intervention. She was the first nurse midwife to obtain hospital privileges in Fort Worth, Texas. To increase access to midwifery services for new graduates, she promoted use of computer technology for the post-graduation examination. As an APRN educator, she founded the Women's Health Nurse Practitioner Program and initiated the Doctor of Nursing Practice program at Texas Women's University. Welcome to the Academy. David Marshall. Dr. Marshall is an executive nurse leader and disaster response professional. His work has advanced clinical nursing practice and disaster nurse leadership. He recently secured funding for the first makerspace in a U.S. hospital, a place where nurses can take their innovations for 3D prototyping. Welcome to the Academy. Melanie McEwen. Dr. McEwen is an experienced academician and author-editor of 3 major nursing textbooks, which more than a quarter of a million nursing students have used. In addition, her research has been influential in strengthening RN-BSN education by clarifying practice expectations. Welcome to the Academy. Lula Westra Paleo. Dr. Palaio is an executive nurse leader and academician. Her innovative educational and mentoring endeavors have improved the success of underserved Hispanic, military, and veteran students in their academic achievements in nursing and allied health. Welcome to the Academy. Drew Riddle. Dr. Riddle is a practicing clinician, educator, and researcher. His work in anesthesia care, evidence-based practice, and pharmacogenomics has influenced national and international health policy. He is the current president of the Texas Association of Nurse Anesthetists. Welcome to the Academy. Jennifer Sanner. Dr. Sanner's research targets neuropsychiatric health to improve health and symptoms for those living with chronic illnesses. Her advocacy for enhanced and expansive genetic and omics-based biobanks to improve research infrastructures for all scientists creates collaborations to impact societal health. Welcome to the Academy. From the country of the United Kingdom, Alan Finnegan. Alan Finnegan. As a military veteran who had a 28 career in the Army, Dr. Finnegan has been dedicated to improving the health and well-being of the British Armed Forces community. His research portfolio has a military mental health focus, particularly the effect that depressive illness has on service personnel and their families, why veterans avoid seeking treatment in particular. Thank you for your service and welcome to the Academy. Ann Lloyd Keene. Ann Lloyd Keene was the first RN elected to the British Parliament. As the first nurse government minister, she gained the respect of both sides of the House for her passion and knowledge. She became the chair of the Prime Minister's Commission on the Future of Nursing and Midwifery. And I understand we have congratulations from Gordon Brown on your behalf. Welcome to the Academy. From the state of Utah, Margaret Clayton. Dr. Clayton's interdisciplinary research integrates nursing and communication science, resulting in in-depth understanding of communication processes during breast cancer survivorship and at end of life. Synergy between her leadership and research has helped her to promote a national patient-centered research agenda. Welcome to the Academy. Susanna Rose Cohen. Dr. Cohen is a nurse midwife, an innovative educator, and an implementation scientist. Through interprofessional partnerships, she facilitates simulation learning, team communication, and systems thinking with healthcare professionals globally, thereby improving emergency response and person-centered maternity care in low-resource settings. She is the co-founder of the nonprofit Pronto International, which offers transformative trainings that catalyze providers to make individual team and system changes. Welcome to the Academy.
Our fourth honorary fellow this year is Cheryl Sullivan. The retired CEO of the American Academy of Nursing, Cheryl Sullivan, has an extensive background in federal and state public policy development and implementation, state government, public university and nonprofit administration, and public and private fundraising. Prior to joining the Academy, Ms. Sullivan served as the Deputy Chief of Staff for Policy to former U.S. Senator Evan Bayh, and played a central staff role in the Nurses Higher Education and Loan Repayment Act and the Children's Healthcare Quality Act. Among her accomplishments as CEO of the Academy, she promoted nurse-designed interventions and innovations through the Edge Runner initiative, facilitated expert panel research, and publication of policy briefs. She launched with fellows the Institute for Nursing Leadership that places nurses on national and gubernatorial boards, and promoted a culture of philanthropy that significantly increased donor gifts. We welcome Cheryl Sullivan into the Academy as an honorary fellow. From the state of Virginia, Jean Alhusen. Dr. Alhusen was one of the first to show the influence of maternal depression and intimate partner violence on maternal-fetal attachment, fetal growth, and early childhood development in both community-based and population-based samples. This work continues to inform policy and practice. She currently serves on the board of directors for the Association of Women's Health Obstetric and Neonatal Nurses, where she also co-chairs the Research Advisory Panel. Welcome to the Academy. Teresa Marie Davis. Dr. Davis led the implementation of tele-ICU in critical care in 2004. Which brought her to the forefront of virtual communication. Her research centers on healing touch interventions to decrease pain and anxiety in critical care, encouraging clinical teams to explore non-pharmacological solutions to promote healing. Welcome to the Academy. Melody K. Eaton. Dr. Eaton's leadership in nursing workforce development advocacy is far-reaching. Her work led to a new BSN program in an underserved area, increasing nursing faculty salaries, boosted nursing school enrollment, and improved access to care in Virginia. Welcome to the Academy. Jill Howie Esquivel. Dr. Esquivel has developed and tested interventions to improve the self-symptom management of symptoms and reduce hospital admissions for patients with end-stage heart failure. She has investigated patient strategies that are culturally appropriate in vulnerable populations, including Australian, Aboriginal, and rural communities. Welcome to the Academy. Nancy Jallo. Dr. Jallo is an academician with outstanding contributions to nursing and nursing science focused on improved maternal well-being by developing testing and disseminating innovative interventions to self-manage stress for vulnerable women at risk for health disparities. Welcome to the Academy. Patricia Kinzer. Dr. Kinzer enhances the health of women through innovative biobehavioral research. She has shown that epigenetic mechanisms influence perinatal depression and can be ameliorated with mindfulness interventions. Dr. Kinzer is a governor appointee to the Virginia Board of Health. Welcome to the Academy. Patricia Carter Lane. Patricia Carter Lane's unwavering passion and expertise for neuroscience health policy has served as a catalyst for impacting neuroscience health practices through legislative action. Her trailblazing work in community stroke awareness includes producing, directing, and hosting a public television series on neuroscience topics. Welcome to the Academy. Mary McCabe. Mary McCabe has focused her award-winning career on cancer survivorship and medical ethics. She has championed the role of nurses internationally by developing new NP models of survivorship care and by developing a strategic role for nurses on hospital ethics committees. Welcome to the Academy. From the state of Washington, Teresa Ward. Dr. Ward has led NIH-funded studies to promote sleep and health outcomes in children with and without chronic heart conditions and their caregivers. Her work has advanced public policy through implementation of later school start times and changed clinical practice by addressing clinical barriers. Welcome to the Academy. From the state of Wisconsin, Christine Thomas Dryfurst. Dr. Dryfurst's development of debriefing for meaningful learning, adopted by 300 schools of nursing, has significantly transformed nursing education nationally and internationally. This novel approach has influenced how educators conduct debriefings and enhanced students' development of clinical reasoning and decision-making skills. Welcome to the Academy. Lisa Hansen. Dr. Hansen is a nationally recognized nurse midwifery researcher, educator, and program director. She co-established the Aurora Midwifery and Wellness Center, a full-scope nursing practice where she served for 29 years. As an NIH-funded researcher, she has established a long-standing program in research in probiotic interventions that contributes to women's health. Welcome to the Academy. Barbara Day Peneckenstein. Dr. Peneckenstein combined her expertise in nursing administration, leadership, and academic nursing to develop nursing leaders serving on boards. Her work has influenced workforce planning, increased workforce capacity, and improved healthcare work systems, including addressing the critically important quality issue of fatigue in the healthcare workforce. Welcome to the Academy. Ladies and gentlemen, it is an honor to present the 2018 Fellows of the American Academy of Nursing. Let us welcome all our new fellows into the Academy.